This is Mark Chris from Memorial Sloan Kettering, continuing on some suggestions and practical issues in dealing with folks with advanced cancer, pursuing cancer care in this time of the COVID-19 pandemic. Again, first and foremost, do not let the pandemic distract you from your efforts to care for patients. Remember the goals you set at the beginning of care. Remember the goals and strategies that you and your patient have agreed to, and try to move them forward. Yes, they need to be changed. COVID-19 cannot be ignored, but it can be managed like anything else. And we in oncology are used to managing complications. When things get in the way, we find a way around them and allow the plan to continue. And more than anything else for our patients, it's treating their cancer that's of greatest concern to them. And COVID-19, of course, is a grave concern as well, but it's probably number 2 to cancer for them. In many ways, it's more of a concern to them from their family's point of view and from their interactions with other people. I want to say a word about testing. First off, I'm not an infectious disease expert, and I would first and foremost urge everybody to follow the COVID-19 testing standards for their institution, for their state, and from the CDC. I think that's the best advice we have, and it keeps changing. For a patient that has symptoms but is not ill enough to require hospitalization or require a medical evaluation, their recommendation is that they stay home, stay in contact with their healthcare team, and they do not necessarily need to be tested. Who should be tested then? I'll just tell you my experience about where I think the tests have been helpful. One of them was a person who had a family member who was also a healthcare worker. And while that person had some mild symptoms, totally capable of being cared for at home, the concern was they could have had COVID-19, could have exposed their partner who was also a healthcare provider. So it made some kind of sense to test that patient. We did, and actually that patient was negative. Another issue that came up was a patient that was in need of home care services. And the home care agency asked that COVID-19 be tested begun, because obviously people with advanced lung cancer, they have a cough, they might be feeling poorly, they may have malaise or fatigue, symptoms that could be consistent with COVID. And lastly, there are now clearly people that develop COVID-19 by exposure to asymptomatic or minimally symptomatic carriers, and that's always that possibility. So I think if you're going to be reaching out to bring other healthcare providers into somebody's home, you're probably going to need COVID-19 testing for your patients with advanced cancers. The other thing that has been happening is that patients that are being scheduled for procedures within the institutions, those people performing the procedures are asking that COVID-19 testing be done. Again, all of our patients have coughs, they're feeling poorly, they need to be tested. So be ready for that. Advise the patient that they're going to need to be tested and get that done. And don't let that testing get in the way of the procedures that you and the patient have mutually agreed need to move forward. Try to understand that testing may be necessary in those situations. Get it done expeditiously so as not to delay the tests that you have agreed are the right thing for their cancers. I just want to end with a couple of thoughts on these few discussions. I think the first one is that I'm just amazed how when we talk to our patients, they're just so grateful for what we as healthcare providers are doing here. I can't tell you how many times at the end of a care conversation, the patient turns to me. How are you? I don't want you to be sick, Dr. Chris. I need you. I'm counting on you not to get sick. Please don't get sick. How is your family doing? It's despite all their concerns, it's unbelievably heartwarming to hear them being concerned about me. And the last thing, I heard today on television a statement from the modern Hippocratic Oath, and I thought this was a really good one for the COVID-19. I'm just going to read it to you. One of the things that I guess we all agreed to when we graduated from medical school, and then this is a modern version, I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I think these words can be no truer than they can be today. There's no knife, there is no drug, though hopefully there will be one someday, for our people with COVID-19. What we have to do today is use those other things that we all pledged to do at that medical school graduation.